I'm Dr. Mark Newton, and I work as an interventional cardiologist at Virginia Cardiovascular Specialists. I have a special interest in peripheral arterial disease and venous disease of the lower extremities. We have new technologies that allow us to treat this very common disease that a lot of our patients have, and it's been rewarding to help alleviate discomfort in the lower extremities by treating the venous insufficiency.
Typically, patients will come to VCS having difficulty, pain in their leg or swelling. The physician may order an ultrasound procedure called a venous insufficiency scan. Based on the results of that procedure, they will refer them to one of our vascular physicians who will assess them and see if they are a candidate.
There are two procedures we do to help treat the patients who are symptomatic with venous insufficiency. One procedure is a radiofrequency ablation, and the second procedure is Venaseal. But both procedures are equally effective. They're done as an outpatient. They take about 30 to 45 minutes to do. And after a couple of days, the patients usually can get back to their normal routine.
So for the Venaseal procedure, we use a medical grade glue and inject that into the patient's vein. So when the patient arrives, after the ultrasound images, the physician puts the needle into the lower part of the leg, and we advance a catheter that has the glue into the vein. We will begin then to inject the glue into that patient's vein and apply some external compression, essentially shutting down that vein using the glue to compress against the vein walls. At the end of the procedure, the patient's leg is clean and bandaged, and they go home and they do not need to wear compression stockings. For the radiofrequency procedure, the patient will change into a pair of paper shorts. The ultrasound technologist will do some images of the patient's leg, and then the physician will come in. He will put a small needle into the vein at the lower part of the leg. After doing some localized numbing, we'll advance a catheter with a heating element at the end into the patient's vein and advance it up the diseased portion of the vein. Once that is completed, we will then inject a fluid that will surround the vein, basically creating a heat shield between the vein that has the catheter in it and the surrounding tissue. Once this fluid is in place, then we begin to apply the heat to the catheter, essentially closing the vein down from the inside. Regardless of which type of procedure we do, they will return 3 to 5 days later for an ultrasound. That procedure takes about 45 minutes, and what we're looking for is the presence of any blood clots in the deep vein systems and looking for any outward signs of infection.